Hello everyone, welcome, and I hope you are in good health as well as scaling new heights in your career. Today, we are going to discuss a more serious form of sinus infection known as complicated bacterial sinusitis. While typical sinusitis can be uncomfortable, understanding when it progresses to a complicated stage and the signs to watch for is crucial. So, what exactly is complicated bacterial sinusitis? It starts as a bacterial infection of the sinuses, those air-filled cavities in your skull. This often follows a common cold or another upper respiratory infection. However, in complicated sinusitis, the infection progresses beyond the sinuses themselves and starts to involve surrounding tissues, leading to more severe issues. What causes this progression to a complicated stage? Like regular bacterial sinusitis, it's caused by bacteria that infect the sinuses. These bacteria can thrive in the trapped mucus that builds up after a viral infection. However, in complicated cases, the infection becomes more aggressive, or the body's defenses are not enough to contain it within the sinus cavities. This allows the bacteria to spread to nearby structures. Several factors can increase the risk of developing complicated bacterial sinusitis. These include severe or persistent sinus infections that don't respond to initial treatments, certain underlying health conditions that weaken the immune system, or anatomical abnormalities in the nasal passages that can hinder drainage. It's important to be aware that while most sinus infections resolve without complications, some can progress and require more intensive medical attention. What are the signs and symptoms that might indicate complicated bacterial sinusitis? Many of the initial symptoms are similar to regular sinusitis, such as persistent nasal congestion and facial pressure or pain, often around the forehead, cheeks, or eyes. You might also experience fever, headache, and a cough. Bad breath can also be a symptom. However, complicated sinusitis is suggested by more severe or worsening symptoms, or the development of new symptoms indicating the spread of infection. Some potentially serious complications include orbital cellulitis, which is an infection of the tissues around the eye, causing swelling, redness, pain around the eye, and possibly vision changes. In rare but very serious cases, the infection can spread to the brain, leading to conditions like meningitis, which would present with severe headache, stiff neck, fever, confusion, and potentially seizures. Any of these severe symptoms requires immediate medical attention. Thanks for watching, take care, and have a wonderful day ahead.